So we have diabetes in China.
The increasing prevalence of type 2 diabetes in China has been a major health concern. About 141 million adults, or 13% of the adult population, are diagnosed with diabetes, and only 25% of those people are receiving treatment for it. Type 2 diabetes occurs when blood sugar levels are too high due to insulin resistance or the insufficient production of insulin. And some risk factors include obesity, less physical activity, and hypertension. And over the recent decades, China's economy experienced substantial growth, encouraging changes in lifestyle and diet that ultimately increased those risk factors. The rates are higher among urban residents and economically developed regions. However, 53% of people may be undiagnosed, not knowing that they have diabetes. When left untreated, diabetes can lead to heart disease, kidney failure, and peripheral nerve disease. And that's why it's so important to address diabetes in this population. Otherwise, many will begin to develop non-communicable diseases and health complications and raise the cost of healthcare.
So while China is a developing country and the United States is a developed country, we can definitely see some similarities in terms of numbers for things like infant mortality rate, life expectancy, and access to water. However, we can also see bigger differences with the amount of money being spent on health. So about $600 are being spent per capita in China, while the United States spends triple that amount. And the total expenditure on health in China is 5.6%, while for the United States, it's 18.82%, which is definitely a very big difference. And this is the amount of resources that is allocated to health in comparison to the nation's wealth.
The Chinese Diabetes Society is the leading organization in the fight against the deadly effects of diabetes. It is a nonprofit organization with around 3,900 members located in Beijing, China. Their mission is to prevent, care, and cure diabetes using advocacy for patients, spreading awareness, education, research, and promoting proper medical practices. Their efforts include national academic conferences year-round with more than 3,300 diabetes professionals. They have joined the International Diabetes Federation and collaborate with associations around the world, such as Europe, Japan, and America. And they've also published the Chinese Journal of Diabetes Mellitus, which focuses on type 2 diabetes. Another organization that helps against the fight against diabetes is the Chinese Taipei Diabetes Association. They consist of 926 members with 570 diabetes specialists, educators, nutritionalists, and nurses. Their vision is to improve diabetic patient care with diabetes care systems and to use research to combat diabetes. Some of their efforts include electronic newsletters that they send out to members to advocate for research and to provide newfound education. A journal that they've published is the Formosan Journal of Endocrinology and Metabolism. And one thing that they've done in 2007 is they've made the Taiwan Diabetes Declaration, which raises awareness for the rising rate of diabetes and improves the quality of life for those living with the disease. There are 9 items of the declaration that address care measures, prevention, disease monitoring, and education. Some of the things that they have in the declaration are also appeals that they make to policymakers, asking them to help decrease the high-calorie foods that are out in the country and to educate populations to eat a healthier diet, as well as implementing food labels to be posted for every item. They also had an appeal to medical professionals to educate their patients and require that they monitor their blood glucose at home. Lastly, China's government also makes efforts towards fighting diabetes, such as public health services, where they implement screening, regular follow-ups, health education for public, and professional education. They have made a contract where they ask general practitioners to improve patient care by incorporating the 3 levels of prevention with their patients, and they also provide patients with 4 glucose monitors and blood pressure monitors. They also have mid and long-term plan for prevention and treatment of diabetes, where their goal is to make 70% of patients with diabetes aware of the diagnosis and to deliver high-quality care to 40 million people living with the disease by 2025. In their Healthy China 2030, they want to go towards preventing and controlling chronic diseases such as diabetes, and they work towards diabetes prevention and treatment with their initiative, which is one of the top 15 that is stated in the project.
So in terms of factors that influence the population's perceptions of health and health status, the first one that we're going to talk about is stigma around diabetes. So in China, there is a belief that those with diabetes lack restraint and they're lazy and irresponsible for their own health. And this can cause those who are diagnosed with diabetes to feel self-shame and blame themselves for causing this to themselves. And this negative stigma can have really harmful impacts, and it can cause diabetes to be ignored in terms of education and early diagnosis and treatment. So because of the stigma surrounding diabetes, discrimination also can occur to the point where it affects the client's social and work life. It also increases the risk for further complications of diabetes, such as neuropathy and nephropathy, since those with diabetes don't want to be caught with their medication. So here we have examples of discrimination to those with diabetes. So the first one is that government regulation states that those with endocrine and metabolic disease should not be admitted to colleges or government jobs, kind of showing how this is diabetes has like a negative perception. And then the second example is a 25-year-old woman who did not follow her prescribed insulin plan for more than 14 years in order to avoid stigmatization, later developed renal failure as a result.
Another factor is genetics. With Asian descent, you have less muscle and more visceral fat, which puts you at a higher risk of developing diabetes, especially as a younger person. And with prenatal exposure to famine, it increases your risk of having type 2 diabetes when you're adults. And South and East Asians have variants in their DNA that predispose them to risk factors of diabetes, such as problems with their insulin resistance, pancreatic functions, and metabolic syndrome.
Another one is food culture. So due to the economic growth in China, a rise in incomes and urbanization across the country has led to wider access to meat, processed foods, and sugary snacks. Additionally, with longer work hours and busier lifestyles, this encourages people to use speedy fast food services, some of which are Western fast food chains with larger portions. This increases diets high in calories, protein, and fat. In terms of Chinese culture, rice is a staple in their meals, but unfortunately has a high glycemic index. Some other important foods are grains and carbohydrates like noodles and bread buns, all of which can spike blood sugar. Lastly, we have diabetes and insulin education. In China, a study has shown that insulin therapy is often refused due to the inconvenience, concerns about addiction to medication, pain from injections, side effects of medication, and high costs. The patients who refused therapy were less likely to receive diabetes education since their diagnosis, and thus were more likely to have negative attitudes towards receiving therapy. If they were to start using insulin, they would feel as if they failed to maintain glycemic control through diet and exercise. This shows there is insufficient education for diabetic patients about why their beta cell function is progressively getting worse despite changing their habits. And this is the epitriad for diabetes. For the host are the individuals at risk, which is Asian descent, family history, a sedentary lifestyle, and a diet high in sugars and fats. As for the environment, these are socioeconomic factors such as food accessibility, education about diabetes, food culture, and the availability of physical activity opportunities. As for the agent, or what causes diabetes, there's a metabolic dysfunction, which cells do not respond to insulin normally and leads to trouble regulating blood sugar. Also, there are family history and genetic predisposition of diabetes.
So the 3 levels of prevention include primary, which will help delay the development of diabetes with a healthier lifestyle. Secondary is screening for diabetes and to catch it early. And tertiary is to treat and reduce effects for those who are already diagnosed with diabetes. So the primary for interventions and strategies are a lot about education to prevent diabetes from occurring. We have no smoking because this increases the risk by 51%. Activity, so increasing the activity levels and not having a sedentary lifestyle, because working and gaining muscles increases the ability for the muscles to use insulin and absorb glucose. Next is diet. So Chinese diet or food culture is a lot on white rice, but we want to avoid this as these are refined and processed grains. We want to reach for whole grains instead. Also educating about reaching for water, black coffee, or tea, and avoiding sugary drinks like milk tea or juices. And lastly, eating poultry and fish rather than red meats, because red meats increase the risk by 51%. Losing weight, if you have a high BMI, losing weight can significantly lower the risk of diabetes by 50%. Alcohol should be in moderation. And lastly, environment, which are things that aren't related to individual behaviors. This can include increasing the education of diabetes and prevention in schools, in governments, and the food industry. highlighting the importance of healthier food choices and fixing the stigma about diabetes. Secondary interventions and strategies include screenings. So the first one is the HbA1c test, which is a best blood test to accurately diagnose diabetes as it measures blood sugar levels over the past 3 months. So a normal amount is less than 5.7%, and a diabetic would be 6.5% or more. We also have a fasting blood sugar check, so a normal is less than 99 and diabetic is 126. The glucose tolerance test, a normal count would be 140 and diabetics would be over 200. And this goes for the same for a random blood sugar test where a diabetic would be over 200. Lastly is the tertiary. So these are interventions and strategies that we as nurses could do for those who already have diabetes. A lot of it is education about insulin injections, such as using the back of the arm and the lower abdomen, as these are common sites with subcutaneous tissue, pinching the injection site with a non-dominant hand, and rotating injection sites. Also teaching about the appropriate timing of insulin doses with meals. Blood sugar checks. So we would clean the tip of the finger with an alcohol pad, prick, and then wipe the first drop of blood and then obtain a sample. And then you can check blood sugars before meals. And lastly is to monitor and treat complications. This can include diabetic retinopathy, so having eye exams, blood glucose control, nephropathy, so doing kidney tests, foot care, check feet every day, wear shoes that fit well, trim toenails straight, and don't apply lotion in between the toes. Within tertiary, you want to prevent complications with correct insulin doses and compliance with insulin. So next we have the Pender's Health Promotion Model.
So when applying the health promotion model to diabetes in China, several considerations come into play. So the first thing is individual characteristics and experiences. So factors such as age, genetic predisposition, lifestyle choices, and then other personal factors like biological, psychological, and sociocultural influences all impact individuals' perceptions and behaviors related to diabetes prevention and management. And then we have behavior-specific cognition and effects. So this aspect really focuses on individuals' perceptions of the benefits and barriers associated with adopting health promoting behaviors. And these include things like perceived susceptibility to diabetes, perceived severity of the disease, perceived benefits and barriers to engaging in preventative behaviors, and then activity-related effects. So this can include things like raising awareness and promoting can influence behaviors towards preventative actions. And then there's also interpersonal influences. So this can include things like social support networks, so like family, friends, community organizations, and then family-based interventions, so like peer support groups, collaborations with healthcare professionals. This can help provide like education and resources for the individual who has diabetes. And then another thing to consider is situational influences. So this can include specific things like access to healthcare services, environmental barriers, cultural norms, and then disparities in healthcare. Now, in terms of the behavioral outcomes, this kind of emphasizes the importance of setting like goals and outcomes that are related to health promoting behaviors. So competing demands, this can include things like environmental contingency. So for example, food culture is a very important aspect. So in China, rice is a very popular food, and it's also very common in a lot of meals. So maybe a way to control this is to kind of make healthier lifestyle choices. So for the competing preferences, like choosing different foods to eat that are better, and also doing things like exercising and adhering to the treatment. This can all lead to positive health outcomes. And then we have the overall behavioral outcomes. So this is commitment to following a plan and implementing these healthy behaviors that we discussed. And this will overall lead to positive health promotion behaviors in terms of diabetes management and treatment.
Thank you.